Sub-Saharan Africa has almost 1/4 of the world's burden of disease, but fewer than 5% of the world's healthcare workers. This healthcare gap has affected no country more than Ethiopia, where in the early 1990s, nearly half of its 76 million people had no access to even minimal health care. Long challenged by drought, famine, and poverty, in recent decades, Ethiopia has struggled with the loss of healthcare professionals to countries with more advanced training and greater career opportunities. In response, the Ethiopian government launched an ambitious plan in 1991 to build 500 primary care centers in underserved rural areas and to train healthcare workers to staff them with the help of the Carter Center, a decade-long partnership of the Carter Center, the Ethiopian Ministries of Health and Education, and 7 Ethiopian universities has now trained a core of nurses and other healthcare professionals to address a multitude of very specific health problems in the countryside.
Ethiopia is a very rural country. The healthcare system is inadequate to meet the needs of the people, especially in rural areas. Families face crises in terms of maternal delivery, malaria, HIV/AIDS. These are typical problems, health problems that you will see that they do not have access to adequate health care for.
Called the Ethiopia Public Health Training Initiative, the project has created hundreds of academic curricula and obtained textbooks and lab equipment. Faculties are now better trained, and healthcare workers have more confidence that they can address the challenges they will face in the field, from debilitating diseases such as malaria and blinding trachoma to routine screenings for malnutrition and reproductive health. The result, 90% of Ethiopia's rural population now has the potential for regular care, and the government has set new goals to build an additional 600 primary care centers and graduate 5,000 health officers by the year 2011.
Health officers function probably at the level of master's prepared nurse practitioners in our country, and they will be the ones who will manage and provide and oversee the care in the rural primary health care centers that are currently being built by the Minister of Health.
There has been immediate impact, too. When a severe drought struck the country in 2002, more than 2,000 students trained by the initiative were deployed to villages to construct wells, build latrines, and provide basic health care and nutritional information. The students' quick response changed the course of Ethiopia's history.
We want to have several things happen. One is that there will be access to quality health care for the villagers and the people living in rural areas in Ethiopia, and that there will be a sustained project within the government to continue to monitor and increase and build those healthcare systems.
Ethiopians have struggled to survive for centuries. Now, given the skills and knowledge provided by the Carter Center's Ethiopia Public Health Training Initiative, the country is fast building a sustainable healthcare delivery system to make life better for future generations, and is sharing the successful model with other nations in Africa and beyond.